Welcome back to another episode of Living Vividly. I'm Jackie Hedich, your health coach.
And I'm Daphne Olivier, the original and conventional dietitian.
Today we're sitting down with Dr. Derrick Hines. He's the founder of Acadiana Pain and Performance Rehab here in Lafayette, Louisiana. He holds a doctorate in physical therapy and a master's in osteopathic manual therapy. His practice is known for moving away from the traditional maintenance physical therapy toward a model of regenerative healing, which focuses on the body's innate capacity to repair damaged tissue rather than just managing symptoms. Thank you so much for joining us today.
Yeah, thanks for having me. I'm excited. I talk about this all day, so my wife gave me clear instructions to, she's like, couple sentences and then stop. You're not talking to patients. So I was like, all right, I'll give it a shot.
We give you permission to ramble.
Yeah.
We love it.
Yeah.
So you talk a lot about the system being sickness first instead of health first. From your perspective, why have we gotten so bad at treating pain, and why have so many people accepted chronic pain as normal?
I think especially the sickness first thing, we started with what we could solve. So in a lot of ways, it was just here's the tools we have, what can they do? And so in healthcare, we were just trying to kind of keep people alive, which probably was the right thing 100 years ago. We need to do something to keep these people alive who are dealing with infections, and we need to figure that stuff out. The problem is we got stuck there, and we never progressed that to say can we do this better? Can we actually help somebody heal something at a level that it doesn't continue to affect their life? And because we weren't focused on that, this is an aside. Sorry, my wife, I'm already breaking your rule. So I'm finishing a book. I wrote a whole chapter on the history of pain treatments. It didn't make the book. Maybe we'll make a download for it. And what you looked at in history is everything that we believed about where pain came informed the treatment. So when we thought you had bad spirits, we drilled holes in your head to let the spirits out. When we thought you had bad blood causing it, we did bloodletting. Now we went down this rabbit hole where we thought it was all physical. It had to be the mechanics of the body. And so we've seen we go in and fix all those mechanics, and we do all these surgeries and stuff. And it'd be awesome if it worked. It just doesn't work. And so it's because we were focused on that as our philosophy on where pain and disease came from. And we're just starting to see the last decade, and y'all have probably seen this, the last decade, we were okay, we've been doing this for 100 years and we've made some strides, but now we're still kind of getting the same results we were getting, 50 to 100 years ago. We might need to rethink our focus of where it's coming from, and that'll inform kind of the future treatment options. So we were focused on the wrong thing.
You said a word heal in that spiel, which rarely ever gets said in medicine. We don't treat to heal people most of the time. We treat to decrease symptoms. And so that's where I think that's where we've gone awry, is that there are ways, in many cases, not everything, but there are ways to heal something, to stop it from happening, to stop the continuation of it. But we just want to make sure that you're comfortable. And that's part of the problem.
Even most of the diagnoses that we get are all symptom descriptors. So
Okay.
if you go to the doctor and they're like, you have shoulder tendonitis, and you're like, oh, this is my problem, is I have shoulder tendonitis. You have an inflamed tendon. You have a swollen, inflamed tendon. So they didn't tell you anything about what caused that or what's going on there. They just described your symptom. If we look at even arthritis, you're just describing the symptom that's happening inside the joint.
So is tennis elbow a better way to say? Daphne had tennis elbow at one point.
I did.
Exactly. So tennis elbow, we're even getting worse with it. We're just saying you did an activity that bothered you.
Yeah. So that's the layman's, dumbing it down. We call it tennis elbow. I know there's another name for it, but yeah.
So it's all we're doing is describing the symptom in the body. This goes back to what we're focused on is how we're going to do it. If the way we diagnose most things is to describe the symptoms, what are we going to do to treat them? Mm-hmm. We're going to just treat the symptoms that we have.
Right.
So when we look at those things, you're how do we move off of symptom management and move to healing? So almost everything we've done in healthcare for the last 50 to 100 years has been what I consider scar-based healing, so fibrotic-based healing. So you end up with an injury, they do medicine or injections, they do surgery. All of these things kind of let your body go in and scar up and heal the tissue by replacing it with less strong, unhealthy, less flexible tissue, scar tissue. Now we try and let you manage that, but how many people do y'all know who have like an injury when they're in their 20s and they're like, I'm 50 now and that old injury is still there. Like I've managed it over these last 30 years, but I never did something to truly heal back to native-like tissue. And so when we look at those things, when we look at the stuff that we do right now to just manage symptoms, we're actually in a lot of ways encouraging scar-based healing. We're giving you medicine. We're giving you an injection to just like block the signals so that your body can just go in and scar it up. And then you like deal with the repercussions later.
So I thought scar tissue was stronger than...
Scar tissue is very interesting. If you pull on scar tissue in one very clear direction, it's quite strong. If you move off of that angle by like the tiniest little bit, it's very weak. It breaks and fractures. So like when you tear a muscle and your body goes and scars that. In scar-based healing, one of the big things that they do in traditional therapy is we need to remodel those scar fibers so that they're in line with the direct pull of that. Because if you get out of line with that, those people re-injure their hamstring or they re-pull the muscle and they're like, oh, I injured it again. No, you didn't. It was never healthy. You never had true, healthy, flexible tissue in there. So when you look at moving away from scar tissue to native-like healing, you have to go in and problem solve. And like, how could we support the body's process to not just lay down scar tissue and patch it up? I mean, that's really what it's doing. Our body's just going to patch up these things. How could we move away from that to move to a system that actually regenerates healthy, like native-like tissue? That sounds like a big thing, but if you actually just break it down and dissect
I was going to say, tell us what that would look like. And for a person who has gone to physical therapy and they've done the thing that physical therapy does, give us an example and what traditional physical therapy would do versus what is possible and what would be capable of getting back to native tissue.
Yeah. So I had a patient, this was in Alabama. Her name was Deborah, love her to death. She had a surgery and it injured her nerve. So during the surgery, they damaged the nerve. So she comes to us and we're trying to heal the nerve. And at the time, so we're 15 years ago, what they taught us in school is nerves don't heal very well. So I'm like, look, we're going to do everything we can. We're going to do these exercises and stuff, but nerves just don't heal well. So we'll see where you go. And she was like, well, what would have to happen for my nerve to heal? Very simple question. And I just was dumbfounded. That seemed like a tiny thing. I was fairly young.
Did that take you down a rabbit hole?
Practitioner. I'm here, like 15-year rabbit hole of like, okay, well, how do we dissect what truly needs to happen to do that? In traditional physical therapy, even treatment, like this is just everything. We don't really do a lot to change that repair process, right? We're giving people exercise. We're doing hands-on stuff. We're probably showing them some lifestyle modification stuff. All of that is just letting the body do what it naturally is going to do. That relies a lot on what's the environment like in my body? What's the nutrition that I'm putting in to fuel all these processes? What's the cellular energy that I currently have? A lot of things affect that. What's the signal that I'm getting in my body? Do I still even have a healing signal or a repair signal happening? What's the blood flow to the tissue that we're working on? And then what's the activity that I'm having to train it on? Like if any of those things is missed, healing stalls. You won't continue to heal if you miss one of those. In the traditional model, we're only going to a little bit of the blood flow through activity, some of the loading that needs to happen. And other than that, we're relying on the body to do steps 1 through 4. And like those are the most important ones to actually get into true native like healing, regenerative therapy. So like when we're looking at it, this goes into like, how do we break this down? So the first thing that truly needs to happen for us to regenerate healthy tissue is you need a real signal to tell the body to heal. Now, if you just had an injury, that's really easy. But if you've had a hip pain for 5 years, your body's no longer sending a signal to heal that. We have to redo that signal. You can do that through like medical needling. PRP is a way to go in and like tell the body, hey, there's a new problem, come and heal it. And we're giving it the energy. Things like prolotherapy does that as well. So we have to recreate the signal in your body to do that. To continue that process, you have to have scaffolding.
Is the signal coming from the brain?
The signal's coming from the cells locally, the nervous system, and the brain.
Okay.
So like it's coordinating a whole system attack on it. That gets really nerdy, but it's like
system?
all of them. The immune system gets
Okay.
brought in, the local cellular system, the vascular system, and then the brain's kind of coordinating all of that stuff. But to actually continue down like where I think we should go with regenerative therapy, you have to build a scaffold, something to build tissue on. If we don't have the cells to do that, you're never going to get healthy tissue in there. Your body's just going to patch it with whatever it's got, scar tissue, and it's not going to be healthy tissue. So we can break that down. How do you help the body build scaffolding? We need an environment that supports that. So if we have excessive inflammation, if we're feeding our body bad things, if those cells are not getting the right nutrients that they need, we're never going to do it. We need energy. Like regenerative therapy is a very energetic process. So those cells need to be able to produce energy.
Where does that energy come from?
Mitochondria.
Okay.
All the cells being able to produce mitochondria efficiently. Then we need blood flow and we need nutrient delivery to and clearing out damage from. And then lastly, we need activity and loading. So those 6 things have to happen for us to truly regenerate healthy tissue.
Can you name them again?
So initially you need the signal, you need scaffolding, you need the environment, you need energy, you need blood flow, and then you need the activity. That sounds like heavy lifting. And 15 years ago when Deborah asked me that, I was like, I have no idea. I like truly, we're just letting your body do it. As we've ironed that out, you're like, okay, I can take each one of these and problem solve. Can we get a better signal? Study it. Where does that signal come from? How do we get that? There's some really exciting things on this now I'll have to tell you all about. But how do we break that one down? And can we achieve that one really well? And basically the last 15 years has been going one by one and do we have new research? And some of these things we didn't. I'd say in the last 5 years, 5 to 10 years, some of these have given us tools that we didn't have 15, 20, 30 years ago. So we really couldn't have addressed those very well with the technology we have. But if you just take each one of them and break them down and say, can I do this in the body today effectively, efficiently, and what's the research say? And it's getting closer and closer. So all of this is problem solving each one of these things to actually give the body the tools it needs to regenerate. And we can do it.
It sounds like the practitioner needs to have the knowledge to do it, but also I'm projecting. I think this is what's happening. Patient care, obviously I'm not a physical therapist, but patient care previously, what I've seen people go through, the expectation is that I'm going to go in as the patient. You're going to be the one to tell me what to do and fix me. And my role is to show up to the appointment. Versus what you're saying now is very, very different because obviously I'm going to latch onto the nutrition part of it. But whenever you latch onto just one part of that from nutrition perspective, that's a whole field that we're opening up that needs to be addressed so that we can get the nutrition in, so that you can make the energy, so that you have the mitochondrial support, so that you have the nutrients to bring things in and take things out, like you said. So this is putting a lot more responsibility on the patient to be a bigger part of the healing process, because ultimately, it makes sense when I'm saying this, because ultimately that's the one that's healing.
Yeah.
So it's less on you as the practitioner giving them the right movement and more on you knowing what to do and them actually executing what is happening outside of the clinic.
Without any one of those, this is where this gets a little bit hard for people. If you miss one of those 6, healing is going to stall in true regenerative healing. You're not going to be able to achieve that. When people ask me why patients don't do this, one, I think there's an education that we're not telling them. Like, we truly aren't explaining this stuff. That here's why when I ask you to change your nutrition, here's what it means. I'm not just telling you because I want you to lose 5 pounds for vanity reasons. Like, there's real cellular implications for you.
Hallelujah. Okay.
Do you think they're not telling them that because they don't fully understand it themselves as practitioners? Like, you have to deep dive into this.
Yes, in part, I think they're not doing it. I also think in healthcare we had this belief that patients don't.
They're not compliant.
They're not compliant. They're not gonna understand. We know. We're the holders of the information. There's some ego that was involved there that we think we can understand it and they won't. Every study has blown that out of the water, that when you explain these things to patients, they have better compliance, they have better outcomes, everything changes with it. Also, it does take, this is my life. So I've done this for 15 years in this. We didn't learn any of this stuff in school. This is not something that is taught, and it's a second education. People ask why even primary care doesn't do it. It's like they're taught medicine. Like, they're not doing deep dives in nutrition and how that affects the function. They're not doing deep dives in healing. They're doing some biochemistry and stuff, but it's like you have to give yourself a secondary education, and then you got to be able to communicate that with your patients and teach them, that takes energy. That's a skill set. You've got to care enough to sit and be like, what questions do you have that you really understand this? Because if you don't, I feel like you're going to buy the thing, you're going to get the therapy, and then we're going to get 90 days in and you're going to say it didn't work. And you're like, we didn't really give it a chance to work. And sometimes, like, we have patients where we have to say, like, this might not be the right time. If you say, I can't quit smoking, I can't change how I'm going to eat, I can't change what I'm doing to handle my stress, then maybe, like, go and handle that. Let's build an environment that this works, and then come back and, like, we'll actually get the change that you want. If you have a bad inflamed environment, if your cells can't produce energy, you could give them the best treatment, the best stem cells. Nothing can heal the body except itself. So even when we give stem cells, we should go through the hierarchy of what regenerative therapy is. But even when we give stem cells, if the body can't incorporate those cells and start to make them functional because you have a bad environment and your cells can't produce energy and they can't remodel, you wasted your $10,000 or whatever it is. You did nothing with it because your environment was not set up to heal. So, like, we have to build that foundation, or at least start. I do think it's kind of a reinforcing loop where we can use regenerative therapy to help you start more effectively. And then as you build that foundation, now regenerative treatments work better, and that helps you even further, and it can kind of reinforce and compound. But you can't skip the foundation part, or you're just not going to have an environment that your body can use to heal.
Before we dive deep into the regenerative stuff, you were talking about symptom management and how people with chronic pain, they just kind of manage it. Do you think that as a society, we focus on that because it's inevitable that as we age, we're going to start hurting? And so, especially, like, I'm thinking about my grandma, like, people as they get older, they start to degenerate, and it's just part of life. So we just kind of do the symptom management and we don't worry about healing them.
I think we've been a little bit programmed for that. Like, think of what commercials are. It's like, take this pill and it'll handle your symptoms. You don't need to deal with, like, why you're dealing with headaches. Take one pill a day and it's going to work all day. That's been programmed into us from so many different angles that you just have to deal with that. Even the language of that kind of gives me, like, that you're going to deal with these things. If someone can accomplish it, then we can all accomplish it. We have really good studies and people and case reviews that we can go through a life and we can prevent a lot of injuries, breakdown, tissue degradation. We can do a lot of that stuff even today. I think in the next 20 years, it's going to get even better. But today we have good studies on this stuff. And if we know what those are, then we can achieve that. All of us. If one person with our 99.8% 8% DNA match can do it, we can all do it. There's a woman named Maria Morera. Have y'all heard that name? Maria Morera was, she's from Spain. She passed away in 2024. When she turned 100, they were like, we should start studying this woman, like start looking at her, because she didn't match what a healthy person should be. She was like a little overweight. She, exercised a little bit, but she didn't have the perfect diet. Her cholesterol was a little bit high. She's got something that we need to see. When she passed away in 2024, she was 117. What they found with her was that she never built up excessive inflammation in her system. So over the years, they would check her and they were like, she just doesn't get inflammation in the joints, in the tissues, in the systems. So her body's doing a really good job of keeping inflammation at bay. So those fires never get started that create degradation. The other thing was her cells continue to produce energy. Her mitochondrial worked really, really well. Even for as somebody who's 100-year-old, they compared her to somebody's mitochondria who's like 50. So her mitochondria just continued to produce energy really well, which the downstream effects of that is we don't have DNA damage because they're stressed. And that feeds into the inflammatory process. So when you look at something like that, you're like, maybe we're focusing on the wrong things that relate to that, because we're doing these things to treat the symptoms of it. And if you look at her, her body was just doing this. She really didn't get a lot of treatment throughout her life. She was eating very naturally. She was from a small town. There's all kind of things that we could break down and say, how can you achieve that? Some of that might be through technology. Some of that's through nutrition. Some of that's through lifestyle. How do we handle anti-inflammatory responses? Same thing. All that feeds into a bigger answer. But it starts fairly simple. Can we keep our cells healthy? Can they continue to produce energy really efficiently? Can they not get damaged? Can we keep inflammation at bay? And, she lived to be 117 and there's at 110, she was active. She was not sitting in a chair. She was, living independently, moving around, going to town, all these
Incredible.
things. So it's such a cool story. Yes. I'm what would we change? This gets kind of crazy. What would we change if you thought you could be healthy at 110? What decisions would be different? What activities would be different? Would you take an extra 5 years to go after the passion? Yeah. Would you change your okay, maybe I'm going to work really hard. I'm going to work harder. I'm so worried about work-life balance at 25. No, I'm going to kill it until I'm 35 or 40. And then I'm going to go do this thing. It would change our mindset a lot if we were no, I can be healthy at 100.
20, 30 years of life.
Yeah.
It's possible.
Amazing.
If you knew that it was possible.
Obviously it's possible. Now it's just how do I do that with the cards that I have? We know it's possible. She's not the only case. Hers just was really good because they studied her so early.
At 100.
Right.
Was there anyone else in her family or immediate vicinity?
They had a lot of longevity, but nobody like that. I mean, longevity is in 90.
Gotcha.
But that's still 30% longer from just, tweaking some things.
So it wasn't, I'm just thinking even if I went, live where she lived like she lived, still might not happen.
You might not get to that level, but let's say you were programmed, your genetics say that you're going to have to deal with issues earlier. Old people don't die from different things. Mm-hmm. They just push them way, way back. It's not like they have, different diseases that happen at 117. It's all the same processes. They're just able to stave them off really, really long. So even if you went there now, I would bet, let's say, living in our environment, which is not set up for a lot of these things, let's say your typical life would be 85 years. And if you went and did all the things that she did, using that as a template for how do we keep inflammation at bay, keep cell health, you would probably add 20 to 30% to that. So that's might be crazy, 85, yeah. And now you're, instead of I'm struggling at 85, now I'm still healthy and I've got 15 more years of life. I think we have that much leeway in the box to move it. You can do it.
New goal.
You can do it.
New goal, yeah. We'll see if it works out. Stay tuned for 70 years from now.
Living Vividly episode 1,704,000. He
We're
made
just
it.
Old ladies do this forever. They'll never die. Can't get rid of them. Okay, so let's talk about regenerative medicine. Often people start to think of like devices and treatments. And
again, with regenerative medicine, the assumption is that you have the answer and you're going to tell me, like, you're going to give it to me rather than it's something that I have the innate ability to do.
So there's a hierarchy of regenerative medicine. The one that everyone talks about is tier 4, which is cell-based regenerative medicine. So that's stem cells. If you come down from that,
let's start at tier 1.
I'm going to skip to tier 1. Tier 1 is natural regeneration. So what your body can naturally do in a good environment. So we can support that through like health foundation. Then our body can do some of this stuff. You look at certain organs do it better than others, like the liver does it quite well. Other organs don't do it as well. But we can get some level of natural regeneration. So that's like your foundation. And I feel like in the past, we've lived in level 1, and if level 1 doesn't work, if I don't heal naturally and it works, I skip to level 4. And we are jumping over like where I get really excited. So the second level would be catalyzed regeneration. So can we give your body tools that catalyzes the natural regeneration process better?
Can you give us an example?
So NAD is a big one that falls into this. Even exercise to some degree falls into like catalyzing the regeneration process. Like eccentric training. Have y'all talked about that on the podcast? Eccentric, if you're in the gym, they call it negative. So you're controlling the lengthening of the movement. So if you're doing a bicep curl, you're slowly lowering that. Because that stresses the tissue in a lengthening format, we get like a lot more changes in the tendon and the muscle. So that would even fall into tier 2, like catalyzing it. I love like creatine in this is one of these things that just continues to come out, and like there's more and more research that it helps with a lot of these things. NAD is kind of the one of the buzzwords over the last 5 years, that it helps your cells produce more energy so that natural regeneration process can happen better because your cells can actually do it. The third tier would be regenerative therapeutics, regenerative therapies. And that's whenever we are doing more treatment to get your body to produce the cells healthily. The difference between tier 3 and tier 4 is that in tier 4, we're giving the cells to your body. Like we're going in and making those cells and putting them in.
Give us an example of tier 3.
So tier 3 would be PRP, right? We're taking the blood out, we're centrifusing it, and we're injecting those platelets back in to stimulate your body to be able to regenerate healthy cells.
PRP,
even like
AKA blood juice concentrate.
Right,
is
blood
what
juice concentrate. That's what we call it.
Peptides fall into tier 3. Like activated peptides fall into tier 3 because they can come in and tell your body to regrow healthy cells. Like peptides are little, we talk about them as like little foremen that come in and they're like barking orders. They're telling everybody what to do, how to organize things.
What are examples of peptides?
The biggest one's insulin. Like that's the one that everybody knows about, and we've been using peptides for a very, very long time. I know they've gotten to be the buzzword lately, but they've been around for a long time. The one that gets talked about a lot in the healing space is BBC 157. That stands for body protective compound. That lives in our stomach. Most of the peptides that we are using today are meant to either mimic or enhance the signal that they already are doing in our body. So this is kind of the nice thing because that's a very safe thing for the most part. It's just doing something that our body currently kind of has the capability to do, at least when we're younger. And we're giving it that capability either better or louder now.
So it's just like a reminder, like, hey, you have this. Let's give you a little bit more of it to remind you that you have it.
So like if you look at kids and we tested them in children's stomachs, from about the age of, I think it's like 6 to 25, they have a lot of BPC 157 in their stomachs. This is partly why, there's a lot of reasons, but why kids heal so well. So like in a lot of issues, if you injure yourself early enough, like you see a kid who like gets a cut, they'll heal and it's just gone. There's no scar to it. But there's a little threshold where we get over it. And now if I cut myself at a 9-year-old, now I have that little scar for the rest of my life. So we kind of start to lose the ability to regenerate with full native-like tissues as these things deplete. So like if you looked at, not that we're old, but if you looked at us, especially now if we're going to live to be 117, we have much less of that in our body than a child or teenager is. That's the exciting stuff to me, is that like tier 2 and 3, we've had numerous patients for the reasons we talked about that went and did stem cells, and they weren't as effective as they should have been because they missed one of those 6 steps. And that kind of comes with the territory, is when we go to get stem cells, they're so expensive and they're so fragile, and we're worried about them that we need to go into it having already done a lot of that stuff, because we have to kind of treat that tissue with kid gloves for a little while. So they did not go into that in the best state, and so they didn't work. And then we come back and they drop down, and we address tier 1, 2, and 3, and they're like, that worked better in these situations than me skipping to level 4 and getting it done to me. As we pull back and we're like, look, here's why it didn't work. Your system's inflamed. We've got to start to address that. Your body's not producing energy very well. We need to address that. We've got to start changing some activity stuff. You're not sleeping well and you're not handling stress. So you're going to deplete the energy in your body really quickly. And I can give you the best stem cells, and they know this when I'm talking to them, and they're not going to work as well as they should. So let's make those changes. And now let's step up to level 2 and do a few things to help those cells produce energy well. Let's give you some things to help improve blood flow. And then let's go to level 3, where we can actually tell your body to regrow healthy tissue and see where we're at. You might still need stem cells, but you might not.
When you say better stem cells, or the best stem cells, are there some that are better than others? I have a part 2 to this question too.
Yes. The answer for sure is active live stem cells are going to be the best in terms of like turning into healthy tissue.
But all active live stem cells are the same?
No.
Okay.
No. You're going to have some that have more of an ability to transform as they go through the process. So like the younger, healthier the stem cell is,
okay,
we can take a cell from you and turn it into a stem cell.
Right.
That's going to be effective, but there is a way that we can get kind of a earlier stage stem cell that's going to be more effective at turning into whatever type of tissue that we're
like if I had my baby teeth.
Something like that.
Or like an umbilical cord or a placenta.
Yeah.
So if I needed stem cells, is it better for me to use my stem cells in me?
Not necessarily.
Okay.
Not necessarily. I know that's kind of, it gets into like...
Probably cheaper.
It is cheaper for sure, but at least, I don't know if we have real good studies on this, but at least anecdotally through the kind of like regenerative practitioners that I talk to, this is one of the reasons people are still leaving the country for this, is if we can go and get younger, more active stem cells and use them on you, as long as everything else works, those are going to be more effective at replacing and regenerating healthier tissue. Again, we got to go back to the list, as long as you have checked all the boxes of creating an environment for them to do it.
So if you had stem cells from me,
when you were,
now,
mm-hmm.
and or let's say a wisdom tooth stem cell from me and a wisdom tooth stem cell from somebody my age, same quality?
Yeah.
If I were to use them?
Yes.
Okay. That's kind of what, okay.
Yeah.
Wait, so you could get stem cells from teeth?
Yes. Yeah.
So I have my son's, this is gross, I have my son's teeth from all of the teeth that he's pulled. So at some point...
Oh, it's probably too late now.
Okay.
You have to send them right away. Like when they pull it, you can ask, they can send them whenever they pull like your children's wisdom teeth, they can send it and they can kind of use that. Umbilical cords is another one. I don't know like the storage fees and all that stuff. You're banking on it, but it's like, we want options right now. Things are moving really fast. And so, if you have a child and you have the means to do that and dedicate a couple $100 a year to like holding on to that, so that if they do have, think of like a nerve injury that's going to affect them, and you have that and you're able to use it and it changes their life, it might be worth it to you.
That would end up being
a
cheaper way, probably.
Yeah.
Instead of getting
it's the best way. Yeah. It's just, you got to plan for that.
Yeah.
Like
we're not quite there yet.
Really early. Yeah.
Whenever I had Vivid, the IV clinic, we were looking into doing stem cells and exosome therapy. And the company that we were working with, obviously they use umbilical cord and placenta from donor, like mother donors. Yep. And then I learned later that most of the mothers actually had no idea that their umbilical cords and placentas were getting sold by the hospitals to these biomedical companies, and they were creating stem cells, selling them for a shit ton.
Yeah.
The ethics around that are questionable.
We restricted a lot of the ability to research these things, and it was really based off of them saying, like, was this embryonic stem cells? And at the time, that was like 2% of stem cell research. So we stopped almost a whole field of research for like 20, 30 years, or really slowed it down. And so the rest of the world was like, cool, we're going to fly by y'all. Like, they probably did unethical stuff too, but we could have at that time said, hey, let's put some guardrails around this, but let's not pull funding on all these research things, because we should know these answers already. We should have better answers around what types of stem cells work best for what types of problems and what types of tissue, and what do we do to support and grow those stem cells. We just messed it all up because it became political. I mean, that's really where it probably.
But even not just the embryonic, but just the fact that the moms aren't getting compensated.
Because that we can do today. Like, those are good options for us to do now, but it should be like, hey, I'm going to use this thing for gain. Mm-hmm, right. And I'm not going to tell you about it because you just think it's discarded.
Yeah, it's medical waste and we're going to get rid of it.
Yeah. Not on board with that. Because even if they offer that to you, like, you could be like, no, like I want to keep it. I want to hold those cells. I don't want you to sell them to someone else. I still want you to do it, but I want them for me. Mm-hmm. Okay, great. Or, hey, like, if you do this, we'll save them for you.
Yeah.
And we'll let the people use some portion of it. Like, that might be on board with that.
I'm pretty sure that moms could have come to we could have come to a common ground on that sort
I'll
of thing.
trade you my placenta and you pay for my C-section.
Right. Something like that. We're good.
Yeah. Anyway, okay. We kind of glazed over tier 1. Mm-hmm. That is the foundational. That would be stress management, sleep, and nutrition.
Movement, stress, sleep, nutrition is all going to fall into that. You can branch that out, but everything supporting your natural ability to heal and regrow tissue is going to fall under kind of tier 1 of regenerative treatment.
I want to know, what are the different types of treatment therapy? So you said stem cell, you said the blood juice concentrate, aka PRP. What other things are available? Like,
let's spend some time in tier 3, because I think that's going to be the most exciting part that people can actually use to change it. So peptides fall under that. We talk a lot. There's very few side effects with peptides because they're natural. They're found often in our body. The way they're made matters. So we have seen negative side effects when people are doing like these research grade things, because like those are not going to be medical grade. Those are not going to be as pure. It's just purity. Is there, like, how are they made? And is there any like allowance for toxicity? In research grade, the allowance is going to be lower for toxicity.
So meaning it's more
allowing
pure.
It. For medical grade, it's more pure. So if we've ever seen patients, this doesn't happen a crazy amount, but I'd say we've probably seen 10 or 11 people who got research grade peptides and started having side effects.
Like what?
A lot of times it almost seems like infection type stuff. So like, inflammatory response, pain, ineffectiveness is the one that people just don't notice. Is they're like, I tried it and it didn't work. We try and steer people away from those as much as we possibly can, just because you don't know. Like, you're spending money. I know a lot of times they're cheaper and there's a lot of things that fall under that. So that's in there. Something called high intensity laser, when you pair that with peptides, is we call it an activated peptide treatment, where someone's taking peptides to get it to go and heal a shoulder or heal a knee or heal a hip or heal a disc, or definitely tennis elbow. And we go in and those cells now are getting the peptide that goes in there, and it tells it, sparking orders, hey, y'all need to start building that scaffolding. We need a good progenitor pool of healthy cells to start building native tissue. I need energy. we need our workers to show up and be ready to go. So that's exactly what high intensity laser does. It gets our mitochondria to produce about 8 times more energy.
So it's
you get 8
peptide
times
plus
more.
laser.
Yeah, yeah. Peptides alone in tier 3, they don't address the signal part. They don't address the activity part. They address the energy part, but tiny, just a little bit. So they really are only checking 3 of those boxes. So like, I think if you really want to get the most out of peptides and tier 3 of like regenerative therapy, you need to pair it with stuff. Like if you don't have a healing signal because it's an old issue and you just take peptides, your body's taking those in and it's like, well, I've got signals all over my body.
I was going to say, it sounds like it would probably send it to
it's
some
just going to
other
go
location.
everywhere. And it's going to start in the stomach if you're dealing like BPC. A lot of people start with BPC 157. If you got stomach issues, it's going to start trying to repair that before it even goes anywhere.
Depending on the worst thing in the world.
No, it's good. It's just like that might not be
That's
why
not what
you
you're
were
trying
taking
to do.
it. Like, in people who've had damaged gut things, BBC is really good at helping with that. But if you're coming and saying I need to repair my Achilles tendon, and it's got to repair your gut for 3 months before it even can get to it, you're like, well, that didn't do anything. Yeah, it did a lot. You just weren't telling it what to do. So we pair that with things. You could pair that with PRP. You could pair that with medical needling. You can pair that with laser so that you're telling those cells to like go there.
I'm sorry. When you say laser.
Yep.
Like a infrared?
Please explain.
So it's a laser beam.
Yes. That's what I was hoping for.
You would like that.
PEMF, is that what it does? PEMF?
PEMF is slightly different, but we can touch on that because it falls under like the regenerative therapy protocol.
Is it something you can do at home?
Not to this degree.
Okay.
No, you wouldn't be able to do it. Somebody out there can do it, but normal people are not going to want to spend 6 figures on a device to do that. So laser therapy has gotten really advanced in the last 10 years. I had a laser at my practice in Alabama, and we never used it. Now, again, this is like 15, 16 years ago. The old ones might have penetrated like a 1/4 inch into the body. Nowadays, like these advanced lasers can actually get like 5 or 6 inches, and every cell that they pass through is going to start pumping out 8 times more ATP than it's doing at rest. So that's like 8 times more energy than a regular mitochondria would do. So whatever you're telling those cells to do, clear inflammation, they can do it 8 times better, theoretically. Produce healthier cells, rebuild tissue, build scaffolding, any of that stuff. So there's a lot that gets a little nerdy in lasers, like the frequency matters. So there's been studies about depth of it. So about most infrared panels are operating at 660 nanometers. The lasers that get the deepest are operating at about 1,080, and they penetrate much deeper. The power of them is a lot. And then there's like health implications. So you're like, we're off the skin. You're dealing with skin heat. As the laser starts to increase the cell activity, you feel heat with it, and like if you were using it inappropriately, you could see burns and stuff like that. So probably don't do it at home. That's the stuff that all falls in there. There's other newer activities that I think fall under tier 3 as we're breaking down the 6 rules that we need to do to regenerate healthy tissue. And where we came was just problem solving. So like years ago, I was like, okay, how do you do these things and how do we problem solve? So we initially saw that a lot of people were coming in and the environment was not healthy. And most of them, we could test inflammation very easily at the time. Most of them were dealing with inflammation. So we were like, okay, how do we address that? We start doing some, let's call it nutrition consultation, but we still needed something faster. So we added whole body cryotherapy to actually reduce the inflammatory load on the body. And that was just to create an environment where their body could heal better. That started to help, but then we realized even if we got inflammation under control and we're still trying to get the body to regenerate cells, if they don't have the blood flow to that area. Most of the tissues we're dealing with, tennis elbows, shoulders, knees, are hypovascular. They don't get good blood flow. So the highway bringing good stuff to repair and clearing out damage was not open. And so they weren't able to get, whether it's a peptide or not, to the tissue. And so we started looking, and that's where PEMF came in. It's like, what is the best stuff with this? PEMF was an easy thing. So that's pulse electromagnetic field therapy. And what it does is basically improves blood flow to all the tissues in our body. So it uses kind of a like magnetic field around your body to tell the cells to open up, to dilate the blood vessels, and to get our blood flow to improve. So then we like, okay, we can fix that. Another way you can fix that with hyperbaric therapy, that's a bigger lift, but really, really helpful to make sure that we can get oxygen to all the cells that we need to help them, even in hypovascular situations.
Is that what needling does also?
Needling will stimulate a lot of that. So there's peptides also that create angiogenesis and microperfusion. So peptides can help with improving the blood flow to and from these hypovasculars. Like the disc needs it a lot. A lot of tendons need it a lot. And so in those situations, we have to get blood flow to it or it doesn't matter. So you got to do PEMF, and then we'll use peptides to help improve the blood flow to that area. So then in some of those situations, we're getting blood flow to it, and we've already helped an environment, but the cells don't have the energy to repair. And so then we're like, how do you problem solve that? Well, over that time, laser has gotten better. And you're like, okay, now we can give those cells the energy. The research on NAD is getting better. If you really have had a lot of immune issues and illnesses, your cells are going to be depleted. So we'll stack those two together to give your cells the mitochondrial function to produce all this energy so they can repair. And we just keep going down and problem solving with it. The one we spent the most time on lately is the activity part, because if you've injured your elbow and we go in and we heal those cells, but the tissues are still weak in there, as you try and strengthen those tissues, a lot of times we're starting to like create an inflammatory process, and we were probably compensating for some weakness or movement problem that caused the problem in the first place. So how do we fix that without putting you back into pain? And so there's research that came out of pelvic floor therapy where we call it a MAG system. It's a muscle activation and growth system where they use these concentrated magnets to depolarize all the muscle cells in the target area. So you feel those muscles turn on and squeeze stronger than you could naturally do it. What the studies show on that is if we do that repeatedly, most of them are done twice a week for these little 30-minute sessions, you can grow a muscle like 30 to 40% while you're just hanging out there. So this started with pelvic floor because after women have children, the pelvic floor gets weak, but we also get scar tissue and damage in there, and we lose control of it. So even as we try and teach them to like strengthen their pelvic floor, they struggled. So they started using, like, we have one of these chairs. You sit on it and there's a magnet in the chair and you feel your pelvic floor turn on. Quite interesting. Very helpful. Awesome. But
so
then
does it
these
work
groups
just
started
with
saying,
muscles, or does it work with tendons, ligaments, like that
so
sort
it's
of thing?
pulling on those things, and it's doing it without creating inflammation or damage. So like this is just, there'll be more things, but like this is the latest. We're going through that list of what needs to happen. The one that we needed to problem solve for people was activity, is that we were getting them all the way there, and a very large number of people were saying, I'm getting back to activity, I'm going slow enough, but it's really slow. Like when you're trying to regain activity, you can't move up by more than like 5% a week without stressing the tissues. So this was like, if I can give you 30% more strength in 2 months in the activity part, and we've done all those other things right, well now you're back, you're not compensating, you have the strength to stabilize that tissue so you don't create damage as we start getting you back to your, everyday activities and, exercise and movements and all that stuff. So it's just going through each section and breaking down what's the best thing we can do for it. And there'll be more stuff in the future that comes out that we say, hey, actually there's a new thing that can help the body produce energy better. And like what my whole team is about is like, can we constantly like look for those things and test these and look at research, and like we get technology that comes in our office, probably like our staff, our patients know about it. They're like, what toy do we get? Like every 6 months, there's something that's in the office for a few weeks. It's like we just kind of test it out and like, what's it doing? Does it fill a gap that we can't fill before? And so that's where like MAG came in. It was like, we are dealing with this. And a lot of patients get all the way healthy and then they're like, they're not getting the strength back. We had a patient who had a nerve injury in his leg and he went through this and the nerve was healing really well. But nerves, even if you give them the best environment, might take 3 to 6 months to really get the function back. And I was like, over 3 to 6 months, he's going to get so weak in that leg that it's going to take him years to try and regain the strength. He might not walk normally again. So he started doing this and the MAG therapy with the nerve regeneration. And so at the end of 3 months, not only is the nerve healthy, but the muscle's stronger than it was before. And so like 20 years ago, this person never walking normal. And now like he and his wife were like, you gave me my life back. Like we're going to Broken Bow. We're going to do this. We're like traveling. It's like, okay, you just bought me a lot of late nights. So when we look at the ability for tier 3 regeneration, there's a lot there that we can do before we have to move up. Before anyone does any of that stuff, I think they need to go back and look at like, don't skip steps. Have I done some stuff to improve my foundation? Have I done some things to like catalyze all the activities that need to happen there? And that's just like, most of these are basic. Most of this is, kind of the easy things of movement, nutrition, get some testing and have real answers. I think that's where the catalyzing comes in. Like if somebody thinks they're eating well, I'm like, well, go get some nutrition testing and find out, do you have the basic building blocks for your cells to function normally? Because if you don't, and you come and jump up to just try and take peptides, you're going to not be as effective as you could had you gone in order. So I know that's a lot, but it's like, if we do it the right way, you slow down, but then you speed up. Like you're slowing down to speed up to get faster, deeper results. It's always a little bit hard for us because we want I want the quick fix, but I'm like, I promise you, if you do it the right way, it's going to happen faster, deeper, longer.
So this is how your whole clinic runs.
Yeah.
Like you have how many PTs do you have?
We have 5, and everyone is on mission. Everyone loves this stuff. We have Dr. Chloe who does all the pelvic floor stuff, and like to take all the stuff we just talked about, y'all should have Chloe on. She's awesome. And take that into the pelvic floor world where I didn't know how impactful that was. Like we were talking about statistics, kind of aside, but it was like 50 to 80% of women who have vaginal deliveries deal with like pain, leakage, or dysfunction. And then about 30% of all women, I'm like, okay, just say everybody. Just say everyone. And we're not talking about it. And you take this same model. This is what excites us. You take this same model and you go towards something like that and you say, okay, let's go through the steps. How can I create a signal to get the pelvic floor working better? How can I create scaffolding to break down damaged tissue? How can I repair that? How can I create an environment to do it? How can I give those cells the energy? We can get laser in there. We can get MAG to start turning on blood flow and turning on muscles to work. Like you take that model and you drop it in there. It's incredible to see what people are saying. Some of our older women patients have some very funny things whenever it's there, but maybe we should talk about some of those. But it's an awesome way to think about it when you shift off of that old traditional scar-based modeling where it's like, do some Kegel exercises. Good luck.
Right.
The research says that doesn't work. That is 85% of women are still dealing with it based on the old traditional model. But that goes with everything. That's all of what we're dealing with now. Like the U.S. is 39th out of developed countries in chronic pain.
Wow.
That's stupid. And that's because we do more surgeries, do more injections than any of them. So you're like, we put all our eggs in that basket that if we get really good at treatment in this old scar-based modeling, we're going to be able to beat it. And you can't. Like it just shows us you can't. So we have to take a step. We're going to go into this route and share this and like get patients access to it and start putting out data. Like you have to beat the scientific medical community over the head with stuff until they change, but we'll do it.
So if someone has a new injury, myself as an example,
Hypothetically, right?
Hypothetically, my tennis elbow has been gone a long time ago, but I dealt with it for a long time. So if someone comes in with a new injury, or they're at home and they're like, dang, I really do have tennis elbow, and it is stopping me from being able to do the things that I normally do, what would be their first couple of steps that they need to do?
The first thing I would say is go back to foundations. Are you doing foundations right? When we deal with an issue, we very often kind of let our foundation slip, right? I'm hurting, my back hurts. I'm going to kind of let my hydration, my movement, my sleep, certainly my nutrition around here. People like, I need some comfort food. Like, I'm hurting. Give me the cake, give me the sugar.
Yeah.
That is the time to do the opposite, is to really lean in to make sure your foundation is firm.
And so foundation is sleep, stress,
movement, nutrition, relationships. So lean into those first. There's an equation that I haven't figured out yet, but one of the things I've tried to wrap my head around is, when should we do this? Because once we start to let the like scar tissue based healing go, now I have to go in and break that, get my body to break that down and then regenerate healthy tissue. That's a bigger process on the body. So let's say you have, an injury and you're like, okay, I'm going to take 2 weeks. I'm going to really lean into my foundations, and whatever those little catalyst things that I do know about, I'm going to start doing those. So if it's a soft tissue injury, I'm going to increase collagen. I'm going to increase vitamin C. I'm going to maybe take some creatine, like whatever those like kind of basic supplement things that that catalyze the healing process, do those. But there's a time frame where you have to move off of that. And hypothetically, let's say if you do that and within 6 weeks, you're like, I'm doing all the right things, but that tissue still doesn't feel healthy. Where we're at now with the current research is that the faster you go into native-like regeneration, the better you're going to be in the long run. And this goes back to what we were talking about at the beginning. Like those injuries that you let take hold and scar up and really get there, once you have scar tissue in there, it's a tough thing to really get that back all the way healthy. So if you look at the data on taking thymosin beta-4 is a peptide that helps to go in and regenerate healthy tissue. When they've studied that, what they find is that it replaces damaged tissue with more native-like tissue. One of the peptides nobody talks about, or not very many people in the like systemic world, is GHK copper. GHK copper is in a lot of skin creams because our skin cells can absorb it and use it. But when you take it systemically, it is an extracellular matrix builder. And so it helps to build that scaffold that we were talking about that looks almost identical to your normal tissue. So like if it's a soft tissue injury and you got to that 6 weeks, now I think our trigger as we research this is going to need to be faster. I think we're going to want to say, hey, actually, if you get 6 weeks in, let's do a small version of regenerative therapy on this to make sure and hedge our bets. Some of this probably matters is how much, if that stays damaged, how much is it going to affect your life? If you love pickleball and you injure your knee or your ankle and you're like, this would devastate me, I'm like, we'll start right away. Like, just don't even take the chance that you end up in that kind of scar-based healing that we have to deal with for a long time, if not ever. If it's something small and you're like, I could deal with it if it's there, maybe in that situation, we really lean into foundations and catalyzing the natural healing process as much as we can. Does that make sense? As we look at it, I'm like, okay, there's almost like a new equation that we need to make on this so that people can make a good decision about when to do it. It always hurts my heart when someone comes in and they're like, I just dealt with it for the last year because I thought I could. I'm like, if we had it, like we can still get you there. It's just going to take some lifting. If you had come in 6 weeks in, if you had come in 2 months in and said, hey, this just doesn't feel like it's going in the right direction, then you'd be done. You'd be healthy. You'd be running. You'd be doing whatever it is. So it's like, do the right things, build foundation, catalyze that healing process as you know how. And then if that's not working within 6 to 12 weeks at the most, that's about tissue repair cycles. They repair roughly on 6-week cycles, depend on the tissue, but it's a good rule. So if you give it 2 cycles to really repair and you're like, I'm still dealing with this, even if it's mild, I would say like at least get checked out to see if you need to do something more so you don't have to deal with it. Yeah. For years. Yeah.
So peptides, oral or injected?
So the availability is always better with injections.
Okay.
If you can do it now, with a lot of peptides, you have to inject regularly. So we've been working with a company that was out of Australia, and because of things there, they finally got moved to America where they liposome a lot of them. You can't do this with all of them, but basically they can take many of them and make an oral bioavailable form so you can take it orally, which I think the outcomes have been the same. Whether someone injects BPC or they take it orally, BPC is quite bioavailable orally, especially like this. I think whatever benefit we get from the injection is outweighed by compliance with oral. So that's what it seems like, is like you miss a few of those injections and we have a few of these things that happen. And I'm pretty regular with the oral, even though it's slightly less bioavailable than the injection form, because we get more compliance and sometimes we can just use it longer to actually get deeper into the healing process. We see almost the same outcomes. Sometimes there's a psychosomatic. If you're injecting yourself, you're like, it's going to heal.
We love the placebo effect here.
Yes. I love the placebo
If it
effect.
works, it works.
It shows us a lot of that, how powerful that natural regenerative tier is if you do the right things. Because there's some incredible placebo stories. Our body can do a lot if it's in the right environment and you know.
I'd imagine if you take it orally, any of the peptides orally, your gut has to be in a healthy enough place to be able to break. I mean, that goes with anything,
Yep.
but it is more and more uncommon, I think, to have people who have just healthy guts, you know.
Yeah.
I don't know how many easily available oral peptides there are, but I think I've seen creatine peptides that are like powder form, and maybe collagen peptides.
Those are gonna.
Is that a totally different thing?
That's almost marketing.
Okay, that's what I'm wondering.
That's almost
Okay.
marketing. Yeah, I started seeing some creatine peptides, and I was like, y'all are just using, like, take creatine monohydrate. Don't spend, if y'all are listening to this, I love creatine. The studies on it for brain and body health continue to get better and better. You don't need anything more than creatine monohydrate. It's the cheapest form, and it works the best. So you're like, everything else is marketing. Collagen peptides, it's like, collagen is a building block.
You're taking it for the collagen, not
You're
the
taking
peptide.
it for the collagen. They're like kind of packaging it and saying, because they wouldn't have done that if peptides weren't a buzzword. Let me put it that way.
So there's no like good peptide that you can just buy off Amazon or your local drugstore.
I would not buy any supplements off Amazon.
I had a patient who came in, and poor baby, she bought a peptide off of TikTok and she brought it in. I know. Don't do that, folks. Please don't do that. And I was just like, don't take it. She was like, oh, but it was cheap. I was like, there's a reason. Don't do that. I would really tell people to work with your practitioner. Work with your practitioner, because like we don't have any one brand that we work with. We've curated and studied like who does the best of this, who does the best of this. Hey, can we make a relationship? Some of them we have no relationship with them, but we're like, get this one because they are doing it the right way. They're getting third-party testing. They're doing all of this stuff. I would say find the practitioner you trust, work with them on it, as opposed to going and doing it on your own. Because also what we said, if you just take the peptide, you're only getting 3 of those things. So if you need help getting a better signal to heal the tissue you're working for, you're going to miss that, and you're going to take the peptide and like it's going to be at minimally less effective or ineffective because you just missed one of those. So there are good ones out there. There really are great companies doing it the right way. I would work with your practitioner to find those for your case, because this is like a whole new world of medicine. There's so many of them They can do awesome things, and sometimes we need to use them in conjunction to solve your issues, but not always. Sometimes it's like, this is the one that you need, but there's really exciting ones for like brain health, for nerve injuries, but you kind of need somebody to sit there and like work with you and say, maybe you don't have the gut health. So if we give you, one of these for brain health, you're having nerve issues, you're having brain issues, you had a concussion, we might have to say, look, you need to take a month or two and get your gut into better health so that we can get to a point where you can absorb the things you need to actually help heal the brain or heal the nervous system.
So it's very individualized based on what your issue is and what's...
It should be something that is to you. What are your goals? What are your problems? What is your foundational state now? Now let's build up from there.
Can everyone benefit from taking peptides in some form or another? Or there's some people out there that's like, nah, you're good.
This goes like with everything. Like with certain diseases, we stay away from them. Certainly like organ diseases, kidney, liver, we kind of like, let's really be sure. Cancer is one that's a curveball. There's some studies that show benefits. There's some studies that show you might be causing some growth. Very few of those, but we don't have that answer yet. History of cancer is one that we kind of tread lightly on with the ones that stimulate a lot of growth. Because again, we don't have the studies, but we're just kind of like, let's just stay back. Of course, pregnancy, everybody's like, no, we don't want to touch you. Those are the big things that we look for in terms of everybody. Everyone else, you have peptides in you right now active. You don't have enough to do what we want, but you have some in your body now. And so everyone else is like, you already are benefiting from peptides by being here. You could potentially benefit more if you have the right one in the right amount.
So before we let you go, we always ask our guests one very important question. It's, what does living vividly mean to you?
I think living vividly would be that you have the confidence and the capacity to heal your body as naturally as possible so that you can live the life you're meant to live. And that's why you heal, is to go and use it, to go live. And if living means you're running and hiking and you're creating more things, you have the confidence that you can come back through this process and heal your body. Again, it's not being scared. It's not being fearful of what's going to happen. It's that we have the confidence and capacity to deal with it.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.